Mental health is a crucial part of our overall well-being, yet it often doesn't receive the attention it deserves. In today's world, more people are recognizing the importance of mental health care, but many still face significant barriers when trying to access the support they need. This video will explore the challenges and solutions related to mental health care access, highlighting why it matters for everyone, regardless of age, background, or location. Let's begin by understanding what mental health means and why care is essential for a healthy, balanced life. Mental health refers to our emotional, psychological, and social well-being. It affects how we think, feel, and act, influencing every aspect of our lives. Good mental health helps us handle stress, relate to others, and make healthy choices. When mental health issues arise, they can impact our relationships, work, and daily activities. Understanding mental health as a spectrum rather than a fixed state helps us recognize that everyone's needs are different and that care should be accessible to all. There are many types of mental health conditions, ranging from anxiety and depression to bipolar disorder and schizophrenia. These conditions can affect anyone regardless of age, gender, or background. Some people may experience mild symptoms while others face more severe challenges. Recognizing the signs early and seeking help is important, but unfortunately, stigma and lack of awareness often prevent people from reaching out. Understanding these conditions is the first step toward better care and support. Early intervention in mental health care can make a significant difference in outcomes. When people receive support at the first signs of trouble, they are more likely to recover and lead fulfilling lives. Early care can prevent conditions from worsening and reduce the long-term impact on individuals and their families. However, many people delay seeking help due to fear, shame, or not knowing where to turn. Encouraging open conversations and providing accessible resources are key to improving early intervention. Despite growing awareness, many people still face barriers when trying to access mental health care. These barriers can include financial constraints, lack of insurance, limited availability of services, and cultural stigma. In some areas, especially rural or underserved communities, mental health professionals may be scarce. These challenges can make it difficult for individuals to get the help they need, leading to untreated conditions and worsening symptoms over time. One of the most common obstacles to mental health care is cost. Therapy sessions, medication, and other treatments can be expensive, especially for those without insurance. Even with insurance, high deductibles or limited coverage can prevent people from seeking help. Financial stress can add to the burden of mental health issues, creating a cycle that's hard to break. Addressing these financial barriers is essential for making care accessible to everyone. Insurance plays a big role in accessing mental health care. Unfortunately, not all insurance plans cover mental health services, or they may limit the number of sessions allowed. Some people may not have insurance at all, making it even harder to afford care. Expanding insurance coverage and ensuring mental health is treated equally to physical health are important steps toward improving access for everyone. Shortage of mental health professionals is another major barrier. In many communities, especially rural areas, there simply aren't enough therapists, counselors, or psychiatrists to meet the demand. Long wait times and travel distances can discourage people from seeking help. Increasing the number of trained providers and using technology like telehealth can help bridge this gap and bring care to more people. Stigma remains a powerful barrier to mental health care. In many cultures, mental health issues are misunderstood or seen as a sign of weakness. This can lead to shame, isolation, and reluctance to seek help. Education and open conversations are essential for breaking down stigma and encouraging people to reach out for support. When communities come together to support mental health, everyone benefits. Someone lives can greatly affect their ability to access mental health care. Rural and remote areas often have fewer providers and resources, making it harder for residents to get timely help. Transportation challenges and long travel distances add to the difficulty. Solutions like telehealth and mobile clinics are helping to reach people in these areas, but more work is needed to ensure everyone has equal access. Language barriers can make it difficult for people to find and use mental health services. If providers don't speak the same language or understand cultural nuances, important information can be lost. This can lead to misunderstandings and less effective care. Providing services in multiple languages and training providers in cultural competence are important steps toward making care more inclusive. Primary care providers, such as family doctors, often play a key role in identifying and treating mental health issues. They are usually the first point of contact for patients and can help connect them to specialized care. Integrating mental health services into primary care settings makes it easier for people to get help early and reduces the stigma of seeking mental health support. Telehealth has become an increasingly important tool for expanding mental health care access. Through video calls, phone consultations, and online therapy platforms, people can connect with providers from the comfort of their own homes. This is especially helpful for those in remote areas or with mobility challenges. Technology is breaking down barriers and making mental health support more convenient and accessible. Community-based mental health services are designed to meet people where they are. These programs often include counseling, support groups, crisis intervention, and outreach efforts. By working within communities, these services can address unique local needs and build trust with residents. Community involvement is key to creating effective and sustainable mental health support systems. Schools play a vital role in supporting the mental health of children and adolescents. School-based programs can provide counseling, education, and early intervention for students facing challenges. By addressing mental health in schools, we can help young people develop coping skills and resilience, setting them up for success both academically and personally. Workplace is another important setting for mental health support. Employers can promote well-being by offering employee assistance programs, mental health days, and access to counseling services. Creating a supportive work environment helps reduce stress, improve productivity, and foster a culture of openness about mental health. Everyone benefits when mental health is prioritized at work. Crisis intervention services provide immediate support for people experiencing severe mental health challenges, such as suicidal thoughts or psychosis. Hotlines, mobile crisis teams, and emergency services are essential for ensuring safety and connecting individuals to ongoing care. Quick, compassionate responses can save lives and help people begin the journey to recovery. Peer support networks connect individuals with others who have lived experience with mental health challenges. These groups offer understanding, encouragement, and practical advice from people who truly understand what it's like. Peer support can reduce isolation, build confidence, and provide hope for recovery. It's a valuable complement to professional care. Families play a crucial role in supporting loved ones with mental health needs. Education and involvement can help families understand what their loved one is experiencing and how best to support them. Family therapy and support groups provide tools and guidance for navigating challenges together. Strong family support can make a big difference in recovery. Advocacy is essential for improving mental health care access. Advocates work to raise awareness, change policies, and fight stigma. By sharing stories and pushing for change, advocates help ensure that mental health is prioritized in communities and governments. Everyone can play a role in advocating for better mental health care. Government policies and laws have a major impact on mental health care access. Legislation can require insurance coverage, fund services, and protect the rights of people with mental health conditions. Advocating for strong policies and holding leaders accountable are key steps toward building a more equitable mental health care system. Physical and mental health are deeply connected. Integrating mental health care into general health services helps ensure that people receive comprehensive support. This approach reduces stigma and makes it easier for individuals to get the care they need in one place. Collaboration between providers leads to better outcomes for patients. Prevention and education are key to improving mental health outcomes. Teaching coping skills, stress management, and emotional intelligence from a young age helps people build resilience. Public education campaigns can reduce stigma and encourage early help seeking. Prevention efforts benefit individuals and society as a whole. COVID-19 pandemic has highlighted the importance of mental health care. Many people have experienced increased stress, anxiety, and isolation during this time. The pandemic has also exposed gaps in mental health services and the need for flexible, accessible care. Learning from this experience can help us build stronger support systems for the future. Children and adolescents have unique mental health needs. Early identification and intervention are critical for helping young people thrive. Schools, families, and pediatricians all play important roles in supporting children's mental health. Tailored services and age-appropriate resources make a big difference in outcomes for kids. Older adults may face unique mental health challenges such as loneliness, grief, or cognitive decline. Access to mental health care is especially important for this group, but stigma and mobility issues can be barriers. Providing outreach, home-based services, and education helps ensure older adults receive the support they need. Minority groups often face additional barriers to mental health care, including discrimination, cultural stigma, and language differences. Culturally competent care and outreach are essential for meeting the needs of diverse communities. Building trust and providing inclusive services help ensure everyone has access to quality mental health support. LGBTQ+ individuals may experience unique mental health challenges due to discrimination, stigma, and lack of affirming care. Supportive environments and specialized services are important for promoting well-being in this community. Providers should be trained in LGBTQ+ issues to offer respectful and effective care. Veterans may face mental health challenges related to trauma, PTSD, or reintegration into civilian life. Access to specialized care and peer support is vital for this group. Programs tailored to veterans' needs can help address unique challenges and promote recovery. Research is essential for advancing mental health care. Studies help us understand what treatments work best, identify gaps in services, and develop new approaches. Supporting mental health research leads to better care, more effective interventions, and improved outcomes for everyone. Innovations in mental health care such as digital apps, online therapy, and virtual support groups are making it easier for people to access help. These tools can provide immediate support, track progress, and connect users to resources. Embracing innovation helps break down barriers and reach more people in need. Ongoing support and follow-up are crucial for long-term mental health. Regular check-ins, continued therapy, and medication management help people stay on track and prevent relapse. Building strong relationships with providers encourages individuals to stick with their treatment plans and reach their goals. Measuring outcomes is important for understanding the effectiveness of mental health care. Tracking progress helps providers adjust treatment plans and ensures that individuals are receiving the best possible support. Outcome measurement also helps organizations improve services and demonstrate the value of mental health care. Mental health care access is a global issue. Different countries face unique challenges, but many share common barriers such as stigma, funding shortages, and provider gaps. Learning from international examples and sharing best practices can help improve mental health care worldwide. Communities have the power to transform mental health care. By coming together to support one another, raise awareness, and advocate for change, communities can create environments where everyone feels safe seeking help. Strong community networks are the foundation of accessible mental health care. Resilience is the ability to bounce back from challenges and adapt to change. Building resilience through coping skills, social support, and self-care helps protect mental health. Programs that teach resilience can empower individuals to manage stress and overcome obstacles. Self-care is an important part of maintaining mental health. Activities like exercise, healthy eating, mindfulness, and relaxation can help manage stress and improve well-being. Encouraging self-care routines supports overall health and complements professional treatment. Reducing stigma is essential for improving mental health care access. Public education, media campaigns, and personal stories can challenge stereotypes and encourage understanding. When stigma is reduced, more people feel comfortable seeking help and supporting others. Hope is a powerful force in mental health recovery. Believing that things can get better motivates people to seek help and stick with treatment. Providers, families, and communities all play a role in fostering hope and supporting recovery journeys. Improving mental health care access requires collaboration among individuals, families, providers, and policymakers. Working together, we can identify barriers, develop solutions, and create a more inclusive system. Collaboration leads to stronger, more effective mental health care for all. The future of mental health care depends on continued innovation, advocacy, and investment. By learning from past challenges and embracing new ideas, we can build a system that meets everyone's needs. Ongoing commitment from all sectors of society is essential for lasting change. Everyone can play a role in improving mental health care access. Whether by supporting a friend, volunteering, or advocating for policy change, your actions matter. Small steps can make a big difference in creating a more supportive and inclusive community for all. There are many resources available for those seeking mental health support. Hotlines, online platforms, community organizations, and healthcare providers can offer help and guidance. Knowing where to turn is the first step toward getting the care you need. Don't hesitate to reach out for support. Access to mental health care is a vital issue that affects individuals, families, and communities. By understanding the barriers and working together to find solutions, we can create a world where everyone has the support they need. Remember, mental health matters and care should be accessible to all. Let's commit to making mental health care accessible for everyone. Whether through advocacy, education, or simple acts of kindness, each of us can contribute to a more supportive society. Together, we can break down barriers and ensure that mental health care is a right, not a privilege.